There's a lot of ways that we can run an FET cycle or a frozen embryo transfer cycle. One example and a common way to do it would just be to start a short course of birth control pills, which logistically gives us control over when we start the process, when we do the transfer. Often you'll stop the birth control pills, come in for a baseline ultrasound, evaluate the uterus, the ovaries, just make sure that everything is quiet at baseline. That'll give us the okay to start hormone preparation of the uterus, which can take a number of different forms. There's another ultrasound roughly 2 weeks after starting estrogen, assuming that it has all of the appropriate features, thickness that we would like it to. We start progesterone replacement and then schedule the transfer 5 days after starting that progesterone replacement.
On the day of your FET, we get started on our embryo grades and our embryo thaw. The lab will warm those embryos and take an initial assessment, and we can relatively quickly make our initial determination if that thaw was successful. Perhaps later on, a little bit closer to the transfer, certain labs might take that embryo out for an assessment of embryo expansion, perhaps snap a photo for a keepsake. Embryos are occasionally regraded after the thaw. Those embryos may have experienced some level of cryostress, or they've collapsed, they've re-expanded. The receiving lab may choose to regrade that embryo upon thaw, simply as a descriptive measure so that they can track their quality assurance data. In general, the embryo grades should match from the freeze to the thaw. I'd say the only one exception to that may be if it's a PGT embryo or it was a hatching embryo. There's been a breach through the shell of the egg, the zona pellucida, and through the freezing or thawing process, the embryo has come out of that shell. It might get regraded as a 6 or a fully hatched blastocyst. That would be the most common situation where the stage has dramatically changed in a substantial way.